Welcome back. February is Heart Month. Tonight we want to show you what you can do to improve your cardiovascular health. First, let's look at some numbers. According to the American Heart Association, cardiovascular disease, heart attacks, and strokes are responsible for 1 of every 3 deaths in the U.S., killing 2,200 people each day. That's 1 every 40 seconds. More than 92 million American adults are living with some form of heart disease. So what can you do to lower your risks? Joining us for more on Heart Month is Dr. Jeffrey Sell, Chief of Cardiovascular Surgery at Sarasota Memorial Hospital, Dr. Chippy Nalluri, who is with the Heart Specialists of Sarasota. She specializes in heart disease affecting women, and Dr. Jonathan Hofberger, a cardiothoracic surgeon with a focus on minimally invasive treatments. Thank you all for joining us. A very appropriate day to have this conversation. And I guess my first question, and either one of you can choose it, is how many Americans or fellow neighbors have heart disease but may not know it?
Well, I think 46% of Americans have some form of heart disease. Now that's known. There's a much greater percentage, I think, that is at risk. So that number is probably going to be astronomical. It's hard to say exactly. If you look at people with diabetes, 9% of people are diabetics, but an additional 34% are pre-diabetics on their way to becoming diabetic. So the amount of people at risk is astronomical.
And your focus in many cases is women and heart disease, and you hear about that less than men, and the symptoms of a woman who is having a heart attack is sometimes different than it is of a man, if you could explain that.
Right, so it's actually been a women's disease since 1984. More women have died than men. That data is different this year, but the symptoms can be different. Women can still have the classic sign, the mid-chest discomfort, pressure breaking out into a sweat. But women can have very subtle symptoms. They can simply report fatigue, breathlessness, just generalized back discomfort or heartburn or indigestion. And many women think it's because they're overtired, their life is too busy, or they're just having indigestion, and they tend to ignore their symptoms.
Dr. Sell, do you believe a lot of us don't do what we should in terms of ensuring our heart health and looking for warning symptoms, because we all live very busy and very stressful lives, and it is an issue, I would imagine, of people stopping and taking stock and seeking medical examinations on a regular basis?
So I think most of us don't. I would say the majority of Americans could do a lot better. And there are a lot of little things. For example, now there's data that says even if you just exercise on weekends, you've changed your risk of heart disease. And then there are a lot of symptoms that are not recognized. For instance, we realize now more and more that if you wake up in the middle of the night with anxiety, that may be a sign that your body's telling you you've got a problem with your heart. If you don't have things to worry about, and God knows everybody has enough to worry about nowadays, but still, it's a time when there's so much to do and so many things to know. I think the Fitbit and the attachment of a feedback system has helped a lot of people to get more active.
But I would imagine it's also equally dangerous to separate the normal stress that a lot of us are feeling to what could be signs of a real medical problem, because we do live in extraordinarily stressful times, whether we're talking about the economy, personal finances, or everything that seems to be happening in Washington. How is just the average person who's watching this right now able to separate what could be a sign of something that may be happening as opposed to what we're all feeling about life in general?
I think that patients need to go, or people need to go see their doctors, and they need to follow up with their physicians. I think simple symptoms that maybe they were able to walk long distances for a period of time, and now all of a sudden they can't walk as much as they did. Maybe they're having more indigestion than they were having before. Maybe at night they're not able to sleep, or they're getting indigestion, before they go to sleep or early in the morning. I think all of these changes in regular symptoms that you think you have that don't mean anything can actually be a sign of kind of heart problems.
Right. And Doctor, one last comment before we go to the break, but it's something very important. You said that that even exercising 2 days a week is important, because a lot of people think that, geez, if I can't get out there 3 to 5 days a week, then what good does it do?
Sure. I mean, just a little bit on weekends, making any effort at all, and not ignoring anything. One of the things that happens in Florida is people say, oh, I'm just getting old, because it's an elderly population, a lot of it. But, you know, if you could do this 2 months ago and now you can't, it's probably not that you're aging. It's probably that you've had some other change in your heart or whatever.
Okay, we are just getting started with our discussion of heart health, and it will continue right after we check our weather, so stay with us. Welcome back. Exercise, eat healthy, manage your blood pressure, and don't smoke. You've probably heard this advice before, but have you taken it to heart? And what more can you do to lower your risk for heart disease, heart attack, or stroke? Our guests join us right now with final thoughts. And Dr. Sell, what is the one bit of advice that you would give people who are watching this right now?
Find out where you stand and take care of things early. It's always easier to stay out of trouble than to get out of trouble.
Meaning what? What should people do?
See your doctor, adjust your diet, learn about what your lipid levels are, and stop smoking.
Okay. And Dr. Naluri, you specialize in women's care in terms of heart disease. What would you tell the women who are watching this right now about the first thing that they should do?
Heart disease is your #1 killer. You need to know that. It is 10 times a killer when you compare it to breast cancer. But this applies for men and women. Heart disease is very preventable. And we talk about all the factors that you need to do, that healthy lifestyle, those habits. But I also want to say on Valentine's Day that love is very important. When you learn to love yourself, then you take care of yourself. When you love someone else, that flow, that connection between two individuals actually helps to heal heart disease.
Are you listening, everyone? Please? Dr. Hofberger, I would imagine it's also important to tell people that they should not fear going to the doctor and being aggressive about their health care rather than just basically sitting back and letting things happen.
Sure, and I think that if you find yourself in a position where you do have a problem that requires surgical treatment of your valves or your coronary arteries, that you find out what your options are and explore them. You should go to a place that has a vast experience in open heart surgery and in valvular heart surgery and in minimally invasive surgery. Don't take no for an answer if you find that you're ending up in a place where these things are not available to you. You should seek second opinions. You should go to other places. Often people will drive a half hour to go to a great restaurant. This is your heart. If you have to drive, go.
All right, that's great advice. Before we go, we want to share with you what some of our viewers are saying about a tragic story that we have been following out of Northport. Heron Creek Middle School teacher Holly Fisher is dead. Police say she shot her husband late Friday and turned the gun on herself. Her husband is recovering and says the situation was an accident and that Fisher had never handled a gun before in her life. Here's what some of you are saying. Kim Kustick writes, "Rest in peace, Holly. My family and I are so very sorry to the Morgan and Fisher families. Love and prayers to all of you. I've seen the love and devotion of these people firsthand for years. I am shocked and saddened." Dawn Bushroder writes, "How do you accidentally shoot someone else and then the same to yourself? I can definitely understand the accidental shooting, but this has got to be a first for 2 accidental shootings. Are they in denial?" And Tara Horton writes, "How about everyone stop speculating and just offer a kind word of to the innocent children and the grieving family? Your theories don't do anyone any good." Well, if you'd like to join the conversation about tonight's topic, just visit our Facebook page at facebook.com/news@7. And FYI, want to watch past Roundtable discussions? They're available on Apple TV, Amazon Fire, and Roku. Thanks to our guests for being here tonight. Dr. Jeffrey Sell is Chief of Cardiovascular Surgery at Sarasota Memorial Hospital. Dr. Chippy Naluri is the heart specialist of Sarasota. She specializes in heart disease affecting women. And Dr. Jonathan Hofberger, a cardiothoracic surgeon with a focus on minimally invasive treatments.